Hi, I'm Dr. Ashish Davalbak here at Aesthetics Medispa and Advanced Aesthetics in Pune. In this video, we are going to cover the side effects of facelift surgery. Facelift surgery, or rhytidoplasty as its Latin word is a procedure where we lift the sagging tissues of the mid and the lower face and neck. So it's only applicable for this part, and that is dissected properly and then lifted up and put back into its normal position, and it's a very strong procedure which gives you very significant improvement. Now, as I have mentioned in one of my earlier videos, it is a procedure which takes around 5 to 7 hours. You would have to cover not only the anesthesia related risks, which are constant for any procedure. It's not really different because it's a facelift, but the anesthesia for any long procedure risks are the same, and there's a huge list of risks that the anesthetists usually tell or is given out in the literature. Although all of the risks are very low and all the proper investigations are done to mitigate or to avoid any unforeseen complication during the anesthesia of the procedure. But there are anesthesia related risks, and then there are some risks related to the long operative hours, such as sometimes they are postural or positional because you have been lying on the operating table for that long. But they are all minor, and you do recover from that in due course of time, like pressure sores or little soreness in the heels or the back of the scalp or things like that are sometimes the complaints that some of the patients make because of the long operating hours. But if it were particularly related to the risk that one can face after a facelift, then the most notable complication in the post-operative period is hematoma. Hematoma means collection of blood as a clot under the skin or in the dissected area. Now, these hematomas or clots, they happen because a blood vessel opens up, you cough, you strain, or there's a little bit of rise in your blood pressure and the vessels bleed. You usually do keep drains to avoid any collection of blood in the operative field, but still sometimes you can still get a clot. Now, if it's minor, you can ignore it, body will take care of it, dissolve it, and it will get absorbed. But if it's major, you may have to have that clot evacuated or cleared up and any bleeding stopped, and that's something that one has to look out for in the immediate post-operative period. Now, those who are hypertensive, especially those whose blood pressure is not controlled properly, they would have a higher risk of having a hematoma. And nowadays, that's why we use what is called as an A-net. It is a net that has been described by André Oswald, and it's been popularized by him in Brazil and the US, and it is placed after the surgery to get the skin to stick down and to prevent any space where a hematoma can happen. Now, these A-net stitches are removed in 2 days' time. So those who are hypertensive, those who do have a risk of bleeding or hematoma, I would prefer to use an A-net. So they don't look very pretty, when they are put or in the immediate post-operative period. But once they have been removed in a week's time, all the marks disappear, and recovery is fairly smooth and satisfactory. So hematoma is one of the complications that one has to look out for. Further down the line, it may not be a clot, but it could be clear fluid called a seroma. Sometimes you could get a clear fluid accumulating, which we will aspirate, we'll tap and aspirate, and a few times till it stops reforming, and that is again a minor complication. Bruising is fairly common, and it's not a complication at all because bruise does disappear on its own. It takes around 3 weeks' time. Again, numbness in the skin is a normal post-operative course that also disappears in 2 to 3 months. Wound may take longer to heal. We expect the wound to heal in 7 days' time, 7-8 days, but it could take 2 weeks, and you may need dressings for a little longer. There could be skin necrosis in the areas where the tension is maximum, especially behind the ear or sometimes here in front of the ear. That skin, because it's very thin, and we have it's on maximum tension, sometimes the circulation to that part of the skin can get jeopardized. And because there's not adequate circulation, the skin becomes black, necrosis, and has to be debrided or cut out to allow the wound to heal again. Usually these things heal by themselves, but may require a minor surgical revision or a more involved procedure to take care of the loss of skin that has happened as a result of the skin necrosis. Another complication, of course, wound infections, superficial infections are what one could expect to happen. If it does happen, you would have to take a culture, see which bacteria is growing, and then give very specific antibiotics to control that. And that is again a very rare but complication that one has to tackle if in case it happens. A dreaded complication is bruising to the nerves of the face, and in particular there is a nerve which is called the marginal mandibular, which runs along the border of the mandible and supplies the lower part of the lip, and that helps in the lip to be pulled down like this. So in your animation, the lip depression happens because of the effect of the innervation of the marginal mandibular nerve, and that can sometimes get bruised or even pranged. Or if that happens, then you would have weakness in the depressor of the lip, and that gives rise to a little bit of asymmetry in the lip eversion. This is rare in the sense that it's probably less than 1% incidence of this happening. Although temporary short-term weakness in the muscle is not unusual, they mostly recover by 2 to 3 months time, and long-standing paralysis of the depressors of the lip is very rare, but it is one of the complications that one has to be very wary of and look out for. If in case it happens, and if it's a permanent injury, then your surgeon may recommend paralyzing the opposite side depressor so that your smile gets even, and you can do that with just simple Botox injection or botulinum injection, and that can balance your smile out. Similar to the marginal mandibular, another nerve, a facial nerve that can get bruised, is the one which supplies the frontalis muscle. So it runs from here, goes in front like this, and supplies the muscle which helps in lifting your eyebrow up. And you may find that muscle is not lifting the brow as much as the other side does, and that leads to a little bit of an asymmetry. Usually they recover, may take 3 months, unless of course it has got caught in a stitch or injured in the process of the facelift. And if that happens, then again, Botoxing or using botulinum for the contralateral frontalis muscle is the only way in which you can then even out the eyebrow. Apart from that, you may find that there is some hardness where the stitches are put, which settles down with massage, and the scar may sometimes become a little wide or raised or lumpy because of the tension there, and your surgeon will help you in getting that scar to soften and fade with time. Very rarely you may need a scar revision to help the scar to narrow if it has stretched and widened too much. So this should cover most of the complications that one can expect to see in a facelift procedure. Most of the complications are very rare. Healing is smooth in most of the cases. You just need patience, and as I've said in one of my earlier videos, the first 3 to 4 weeks are not very pleasant. You may not like what you're seeing, but it all pans out really well. I hope you have liked this video. If you have liked it, please click on like underneath, comment and share, and subscribe if you want to see more videos like this. Thank you.